at the entire anatomy, we're just looking at a small portion of the anatomy. Right? One example I like to use is, let's say that you were baking some bread, and somehow or another your ring fell into the bread, or into the dough. And you bake the bread, and now your ring is stuck somewhere inside that bread, right?
Yeah.
And you're like, all right, I need to find my ring. So you're going to take your knife, and you're going to slice the bread. And you're going to be like, all right, do I see the ring in this slice? No. Let me do another slice. Is the ring here? No. And you're going to keep slicing and slicing and slicing until you find a section of the bread that has your ring. Right? Same idea here. We're doing slices and slices and sections of anatomy to locate organs or to locate pathologies. So, what modalities are considered to be cross-sectional?
MRI. CT.
Basically everything but X-ray. Right? Ultrasound, yes. CT, yes. MRI, yes. PET, yes. SPECT, yes. Right? PET and SPECT are nuclear medicine exams. Right? But a lot of modalities are cross-sectional. Okay? X-ray is one of the few that are not, as far as imaging goes. Right? So, let's say instead of bread, you've got a body. Right? You can slice the body up, and you can look inside the body, right? That's exactly what we're doing with our imaging. We're just doing the exact same thing. We're looking at a slice of the body, just like if you could cut the body in half. So, first thing to understand about cross-sectional is that we divide the body into 3 different axes. You have the x-axis. X-axis travels from left to right. You have your y-axis. Y-axis travels from the patient's front to back. Okay? And then you have the z-axis. Z-axis travels from the patient's head to foot. Right? So if the patient is laying on this bed here, right? If they're just laying down supine on this bed, the y-axis, front to back, right? From their back to the front. X-axis from the patient's left to right. And then z-axis, right? Their head goes in, their feet are out, right? Head to feet. So X, Y, and Z. That's, yes, Reagan.
I don't understand Z. How is Z and Y not the same thing? I'm confused.
So,
Is
just
this the way that they're cut? Is this the way the body is cut, or no? Is this something else?
no. This is just regarding looking at the patient. So
Oh, okay.
in a tongue position, right?
Got it. I got
So
it.
y-axis is kind of like MCP, so front.
No. It's like
So y-axis is front to back. So that is going to be like your MCP. Yes.
and the Z goes in like this, right?
And the x-axis is like the MSP.
Yeah.
left to right.
Correct. X-axis is like your MSP, left to right.
Wow.
Z,
said no with your
you
chest.
do.
Yeah.
You don't really have an M anything for the Z, right? You can't really just cut the body in half this way. Yes, the body's not symmetrical.
It's
That's
like
right.
just going in and coming out, right?
Right. So Z is just head to foot.
Yeah.
Z is just head to foot. Like if you cut me like this, like a magician, right, saw me in half, that would be cutting across your Z axis. Right, so you can cut me in half this way, right? So left and right, that would be your X. You can cut me like this, right, front to back, that's your Y. And you can cut me in half this way, top and bottom, so that's your Z.
Oh, okay.
I mean, if I had a volunteer in the saw, I could maybe demonstrate what that looks like. I think I'd have a tough
Yes.
time finding a volunteer.
You should just bring loaves of bread next time.
Loaves of bread next time.
Yeah, that
I
sounds
should.
about right.
I should.
3, one for each plate.
Right, so,
So it's kind of like the MSP, MCP.
right, so X, right, so if I cut the patient like this, right, left and right halves, so this is X going left to right. Okay, so if we're traveling along this X-axis, right, we don't necessarily have to be MSP. We could be a little bit more to the side one way or the other. That is our sagittal. Okay, and slices which go along this X-axis are our sagittal slices. So this is what it would look like if you cut something sagittally, right? If you cut me in half this way, you pulled apart this half and you looked at me inside, you would be able to see this half of me right there. This would be along your Y, right? Front to back. right? So kind of like your MCP, or mid-coronal, right? So Y is your coronal plane. And if you cut along the coronal plane, you get your coronal slices, right? So once again, if you cut me in half like this, you'd take off the front, you'd be able to see the back half of me like this. That is a coronal slice. And finally, our z-axis is our axial or our transverse plane. Okay, notice that there are two names here, axial and transverse. Okay, so cut me in half this way, right? Just in half, and then you would be able to see the inside like this, right? So in this example, right, it's like you cut my head like this, and you took a look at the top of my head, right? Just chop it like this, pull it off, looking at my head that way. Okay. So these terms you have talked about with Mr. Donahue. Right? If the plane is perfectly centered on your x-axis, cutting perfectly down to divide me into left and right halves, that is your MSP. If you're cutting here to perfectly divide me into front and back halves, so along the y-axis, that is your MCP, your mid-coronal plane. And then if you do have some sort of slice which is not sagittal, coronal, or axial, if you have a slice that is at some sort of weird angle, we call that oblique, right? Just like an X-ray, same thing, angled, so oblique. So, main things to know: X, left to right, sagittal; Y, front to back, coronal; Z, head to foot, axial or transverse. Very good. Those are the main things you should focus on, right? That's the vocabulary you need to know to talk about or to describe this.
What was the transverse one again?
Also known as axial. That is the z-axis, head to foot.
Thank you.
You're
So are
welcome.
we doing this in pathology?
Yes.
Well, what's the full name of the class?
Cross section.
It is
Pathology.
radiologic pathology with an introduction to cross-sectional anatomy. That's right. That's the full name of the course.
So does that mean we're done with pathology?
So yes, we are done with pathology until the final. Right? But yes, we are no longer going to be discussing any new pathology. We're just going to be focusing on this stuff here. So, what do you see here?
Lungs.
Yes, you've got lungs here. So how did we slice up this patient?
How do you know that's
Transverse?
This is transverse, this is axial. Let's look over here. Okay, you can see the lungs again, right? Ooh, what's this weird thing here?
The heart.
That's right, this is what your heart actually looks like when it's not in an X-ray. Not S. This is cutting me like this.
You good?
Yes, MCP, you're cutting me like this. You're cutting me like this, pulling off the front to look at me inside, right?
So MSP.
So
MCP.
Sorry.
MCP. If you want your MSP,
that's
this is going to be your MSP.
Yeah.
You take me, cut me like this, right? Pull off the left side so you can look inside, and that's what you would see. So if you need to, right, just think of it, right? Standing like this. Which axis is this, left or right?
which axis is the
This
x-axis?
is
The
your
X.
X. Left to right is your x-axis.
Yeah.
Right, so that's my image. Over here, right? Now it's going front to back. That's my Y. Good. Over here, I'm like laying down. You're going to the foot. Right? Z. Very good. By the way, guys, for next semester, start practicing doing this, right? You're going to need to do that for your SMBs.
CT.
For what?
They already did orthotic chest. SMBs. You have to practice your SMBs, right?
What is that?
Oh, the head work. Oh, when you
Head work, yes.
Head work. SMV. Yeah.
SMB, head work.
And your waters and all that. No, the water.
We have
The
to
head's still gonna be like
Oh,
this.
just kidding.
'Cause like they say, your head
Do
will
Yes.
we have this in
your
any
head's gonna be
book
like
or is it going to be
this.
just PowerPoint from you, sir?
So, that's a great question. I'll answer that once we finish this up.
MRI.
Well, it's the CT.
Oh.
What kind of slice is this?
It is axial.
Transverse, axial, very good. What about this?
Oh, that looks bad.
Coronal, good. What about this?
Sagittal. MSP.
Sagittal. I don't even know what that is.
What is that? Foot.
They look like the foot.
Yes, that's a foot.
How?
This is
That's the foot.
left foot.
Uh-oh.
Chop like this.
Please don't
Or no, sorry, right foot. Chop like this, so right big toe. Right? First, second, third, fourth, fifth.
It looks so weird.
That's what a foot looks like in cross-sectional. So in this case, right, this is
Sagittal, mid-sagittal.
So that's the left.
This sounds like I get
Coronal,
that.
right?
This Phung
Not
like
order,
so
coronal.
I believe so.
Yes.
Like 99%.
What is it?
Coronal.
Fingers are going,
Corona?
toes are going the front.
yeah, the toes are somewhere out here.
Oh,
The
front
toe
to
is,
back.
the toe is shooting out like this.
Also, it's just
There's the toe. So
this
we
one.
chopped off
Just
the
one
toes.
slice.
This is what happens when you chop off the toes. Right? So yeah. Right? So at least in anatomic position, right, that would be coronal. Right? But but if we do end up talking about this, usually it ends up being something like, well, you know, that's like the long axis. So some people call that your axial because it's along your long axis. So don't worry too much about that. That was just to show you. So do you need to know? No, I'm gonna mainly ask you about something like this instead. What is this?
Transverse? No.
Yes, this is transverse now. This one you cut the patient like this, right? They're laying on their back. If you're ever not sure, right, you can see the table here on your CTs. Right? The table shows up on your CTs. Okay? What's this?
The brain.
Sagittal.
That's a
right.
sagittal.
Right? Patient sits like this, so cutting like this, sagittal.
Front to back.
Very good. How about this?
Sagittal. Sagittal.
Yes, this is another sagittal. This is a sagittal abdomen.
Mm-hmm.
Right? From the abdomen, you cut the abdomen in half, right? You see this nice little,
L spine.
you see this nice little curve here, this kyphotic curve. What has this kyphotic curve? Close. Sacrum.
Yeah.
Sacrum is your kyphotic curve right there. Right down here, this is your pelvis. I know it doesn't look like a pelvis, but that's your pelvis.
The white bone.
Those are the bones of your pelvis. And then
All these are
Yes.
CT scans.
this is CT, yes. So the bones here are showing up white on your CTs.
It look like an ear.
Right.
Ugh.
What is this?
They messed up.
Sagittal.
The patient moved out.
No, patient didn't move.
Why is it white?
Sagittal?
Yes, so you see this?
Yeah, that's her head.
Oh, you can see
That's
better.
lips.
Lips, right? Come on. This?
The nose.
No, right? So once again, right, patient like this, right?
Uh-huh.
So,
It's sagittal.
sagittal. Very good.
Yeah, sagittal. Sagittal.
Ooh, what's this?
That's fine.
Sagittal.
Spine.
It's an MRI of the lumbar.
It is an MRI of the lumbar, yes.
Oh, is it the top?
Without
For using the
contrast.
context
Yes,
clues.
with and without contrast.
Right? So, lumbar spine, we see that nice curve. What kind of curve is this?
Scotty dog is also there. This is the.
A Scotty dog.
This is also the concave curve.
What kind of curve?
I think she meant spine.
Is this kyphotic or is this lordotic? Lordotic.
Lordotic.
Right, lordotic curve. So front, back. Right? So you notice lumbar spine, so you know that this is your lordotic curve, so that has to be the front, that has to be the back. Right? And then down here you've got your sacrum as well. So once again, looking at it from the side, cutting like this. You can see the whole spine up and down. Okay, another lumbar spine. This time, how are you looking at it?
Front to back.
Coronal, that's right. Like this. you can see the spine, and next to the spine, what do you see here?
Kitty.
Kidneys! These are kidneys.
Oh, happy.
Right kidney, left kidney.
It looks like
So how are you seeing it
Aliens, yes.
as a coronal plane?
Corona, you're looking at it from the front like this. That's why you can see the kidneys on the left and right. And then the spine down the middle. Yes.
Anytime you see anything like
No, no, no.
that,
Yeah.
okay,
What's
anything
all
you
those
see
dark,
from the
that
front
dark circle at the bottom?
that
Like
is,
a little bit more down? Yeah.
Here.
Those.
Oh, that's your pelvis. And this, I don't know if you. Your psoas muscles, very good. Psoas, your psoas muscles, yes. Yes.
Oh, no, I'm explaining so well.
Okay.
These look like those ink spot tests that you take as a therapist.
Rorschach test?
The Rorschach test?
Yes.
Yes. Yeah. It takes a while to sort of read these. I still think at a first glance they're more legible than ultrasound at least. Because you can at least kind of make out what they're supposed to be. But yes, we're going to spend the next week or two sort of getting ourselves accustomed to looking at these sort of images.
It's like a caterpillar with wings.
Cross section of the brain.
Alright, let's see.
Pinky. Pinky.
Alright, that's about done. Alright. So, using the brain as an example for cross-sectional, right? Because the brain is a very common site for examinations in both CT and MRI. So here you have all the different parts of the brain. You do not need to memorize all the parts of the brain right now.
Ever?
Not yet.
Unless he
Right
decides.
now.
Right now.
Will you need to memorize some parts of the brain for next semester? Yeah, some of them, right? Especially, for example,
Cerebellum.
like your pituitary gland, right? Knowing that fits inside your sella turcica, that's something you're gonna have to know for next semester. Sella turcica, it's a bony structure that kind of cups here.
Never heard of it.
Mhm. Right.
The pineal body.
So, right? A lot of times when you see images, right, it'll give you a picture. It'll also tell you where that slice was located. So here you can see that you're looking at this part of the brain right here. If we cut off a piece of the brain along the slice, this is what that slice would look like. Right? So this is transverse. This is axial. Very good.
Transverse can also be at an angle. It doesn't have to be 90 degrees.
So in that case, it looks like it's an angle, but that is properly transverse because you follow certain anatomy to make it transverse. Okay, here, right? Now we're cutting across here, right? We're cutting here along the back, right? So we're cutting like this. So what is this?
This is coronal.
Coronal, very good, right? So this is what a coronal slice would look like for this part of the brain. And then here, coming straight down the center,
Is that divides into two?
divides into left and right.
MSP.
Yeah, so this is MSP. This is sagittal, or you could even call this mid-sagittal, right? Your MSP. So this is what happens if you cut the brain directly in half, left to right. Okay. So, what I would like you to do, lights coming on, guys. 1, 2, 3. What we're going to be doing for the next 2 weeks is this. Whoops.
Time to go.
Time to go.
So this right here at the very end, right, how we got this?
Mm-hmm.
You're basically going to be doing something very similar for me. On Wednesday, we are going to divide into groups to do a project.
How many?
And
Bonus points?
so we've got 15 people, so either groups of 3 or 5. I think
Five.
groups of 3 might be more manageable, but let me think about it. But what we're going to do is we're going to divide anatomy up between the groups. So maybe one group will have head, one group will have chest, something like that. And your goal will be to take the list of anatomy that I give you and try to find that anatomy in all 3 planes. right? Try and find it in your sagittal, try and find it in your coronal, try and find it in your axial.
Wait, like from Google?
Anywhere you can get your images. So yes, it could be from Google, it could be from another website. If you've got a friend with connections who can
Get you to the mark.
remove patient information from images and they work in CT or MRI, right? And they can send you some stuff, right? You could do that. Just make sure you follow HIPAA, right?
Just know
Make
my-
sure there's no identifiers on
My
it.
friend named Wilson.
But yes, right, your goal is to just, on Wednesday, your goal will be to get together with a group and figure out how you're gonna present to the class your anatomy in all three planes, axial, coronal, and sagittal. Okay, and we'll talk about it more on Wednesday as well. But that's just a sneak peek as to what you're doing. Right, so that's basically it for the semester. Our semester is going to conclude with you all presenting your project, and then we'll have our final in December.
So no more tests?
No more exams.
So we don't have another one to test on, like before or after Thanksgiving?
Correct. No more exams. It will only be the project presentation. Final is the only exam left, yes. Yes, John?
Are any of these questions in the final?
Yes, cross-sectional will be on the final. So there may be questions about which way does the, like what kind of plane travels along the y-axis? Coronal, right? Or which axis goes head to foot, right? Z-axis. Good. Transverse plane, axial plane, very good.
How much
Right?
does this project work?
It's the same as the test grade.
Ooh.
The project is the same as one test grade. So if you're not doing that on the class, right, this is a great chance to boost that test average up. If you're doing great in the class, this is a chance to keep it nice and high. Okay, so it's 1:20 right now. Let's take our 15-minute break. So please be back at 1:35. Please be back at 1:35. Yes.
That's like trying to Taco Bell, but it's like trying to
Yeah, we got like
here.
Tuesday,
All right, let me just.
Wednesday, Thursday, and Friday.
That was how-